The STP for Cheshire and Merseyside came together about 6 months ago when we recognised that by bringing all 30 NHS organisations in Cheshire and Merseyside together, we had a chance of sharing expertise and also sharing resources to think about how we could create a much better future for the residents that we serve in Cheshire and Merseyside. And that's enabled us to start developing some joint thinking about what the real challenges are that we face over the next 5 years, the needs of our local population, our community, and how we can design services much better to meet those needs going forward. So we've identified that we've got some real opportunities to improve services quite radically for people in Cheshire and Merseyside, because what people tell us is that current services that they receive, whether from social care or from hospitals, is quite fragmented, and it doesn't necessarily meet their needs. We have people living longer, which is a great thing, but not necessarily healthier lives. And what they really need is a care system that wraps around them and enables them to feel supported in their local community and in their home, and ideally not go into hospital if they don't need to. And so everybody in Cheshire and Merseyside has a common view about that and a shared desire to see that sort of service be created. And what we'd like to do now is talk to people about what sort of thing would work for them in their local community. Okay, so we recognise that if we did nothing, the demand for health services is increasing year on year, and I think everybody recognises that when you see the headlines about A&E and so on. People need a different service. They need something that's much more local to them, that brings specialists together and local people together to support them. And we've got an opportunity through this plan to actually move that forward. We know that people are suffering some quite significant mental health challenges in our population, and we recognise that by thinking differently about mental health services, probably intervening a lot more early and enable people to access services in their community would prevent them ultimately having to access much more specialist mental health services, inpatient mental health services. So this plan is about trying to support people much earlier when they present with mental health problems. Well, this sets out a blueprint at the moment based on the conversations we've had so far, and some of it is built on conversations that frankly have been going on for 3 years and more in some local communities. So here in Liverpool, through the Healthy Liverpool programme, the community of Liverpool has been thinking about what it means for services locally for that period of time. What we want to do is, going forward, open that opportunity up to everybody across Cheshire and Merseyside and make sure that they have an opportunity to, through their local CCGs and local authorities, to think about how they get engaged in this conversation and how we design services together. So the next steps for us going forward are really to think much more granular level in detail with our local communities about what does this mean. How can we design services together that will really support them in the way that we want to see happen. And the next steps really is about having that conversation with local communities, with clinicians and staff in the health service, together with our local communities, to think about what would work for them and how we can make these services work in the right way going forward.